welcome to another episode of the Prescription for Better Living podcast, where we discuss all things health and wellness in a hip and relatable way. As always, I'm Dr. Hernando Carter, board certified internal medicine physician. Yes, your primary care extraordinaire. And welcome to another episode 27 of the Prescription for Better Living podcast. You know what I need you to do? I need you to subscribe to the podcast. I need you to like and share the video. I need you to comment on the video. I need you to stand on the tallest mountaintop you can and scream to the top of your lungs, hallelujah, Dr. Carter is here. Remember, you can support us by joining our Patreon family, just $1 a month, patreon.com/Dr. Hernando Carter. Also, if you'd like to sponsor an episode, you can email us at contact@rxforbetterliving.org. You see the information on the screen. So this is episode 27 of the Prescription for Better Living podcast. And on our last episode, we had started talking about the social determinants of health. And we really got into just defining what the social determinants of health are. What does that term mean? And now we're going to actually kind of break it down a little bit more to talk about the social determinants of health. Well, why are we talking about social stuff, Dr. Carter? This is a health and wellness podcast. I'm glad you asked. Remember, we said that at the end of his life, Dr. King had made a shift. He shifted from civil rights and started focusing on human rights, on economic rights. So he was really going into an economic movement because he understood that you could have the right to vote, you could have the right to attend an integrated school, you could have the right to marry whom you want to marry. But if we allow economic inequality and economic injustice to persist in our country, then we will still get the same effects. We will still get premature death. We will still get lack of opportunity, lack of upward mobility, perpetuation of generational curses, on and on and on. So as we said, this is where Dr. King was going before he was murdered. We also told you that the American College of Physicians had a position paper that they published in the Annals of Internal Medicine, and this is the paper that we're referencing during this module of the podcast. 2018, this position paper was published called Addressing Social Determinants to Improve Patient Care and Promote Health Equity. And that's what this podcast is all about. Before we defined what the social determinants of health were, we had already kind of started getting into it. Remember, we talked about Superfund sites and environmental pollution. We talked about food deserts and the impact that food deserts have on our health. And so we had already started going down that road. So what are we going to talk about today? Today, we're going to talk about the digital divide. Yes, the digital divide. And you say, well, what does digital and technology and all that have to do with health? I'm glad that you asked. Think about your day-to-day life. I mean, if you're watching this podcast or if you're listening on Spotify, you are using technology. And technology is so interwoven into our lives that we don't really realize how dependent we are on technology and how integral technology is in our lives until we can't use it, until we don't have it. You ever get caught up in a storm where the power gets knocked off in your house and you didn't charge your phone up. You don't have an emergency charger and that phone dies. Oh my God, what do you do? Or Snowmageddon hits the South. You get a light dusting of snow and you get ice and all the power gets knocked out. Oh my God, what do you do? Then you realize just how dependent you are on technology. Well, in healthcare, we are extremely dependent on technology, on computers, on smartphones and tablets, on the internet. So technology is becoming a real barrier for some people when it comes to health equity. So much so that access to internet, access to broadband has become a social determinant of health. And it breaks down along the lines of the haves and the have-nots. If you can afford to have fast internet in your home, high-speed broadband in and around your home, you're going to fare better than someone who can't. So before we even get into the health-specific parts of the internet, let's think about our children in school. I have 3 sons, Ellis, Ethan, and Emery, a 12th grader, a 10th grader, and a 7th grader. And my 12th grader has been in school since about 2008 or so. And there has never been a time in his academic career that he has not used technology for his education. And we're talking from preschool to kindergarten to grade school to high school. He's always used technology. My 7th grader was doing PowerPoint presentations in the 1st and 2nd grade. This was a part of the curriculum. So let's think about the haves and the have-nots. Well, what do you need in order to be able to do homework these days? If you're in grade school, you're in high school, you need a laptop or a tablet or a Chromebook. Well, let's say that the school is fortunate enough to be able to provide you with one of those. You don't have to buy one. Okay. Well, those devices have to be connected to the internet, don't they? Yeah. Well, you have internet at school. Good. You can do work at school. But what about homework? Now the agendas for your classwork are on the school website, Blackboard. You have to log in, right? Now your classroom may have its own Google Classroom that you have to access in order to do your homework. Well, what if you don't have internet at home? What do you do? So you see, there's a difference between the haves and the have-nots, such that not having access to internet at home can be the difference between academic achievement or academic success and academic failure. Well, what happens if you can't succeed academically starting in elementary school? Well, you have the perpetuation of the school to prison pipeline. You have young people who underachieve academically. That puts them in a precarious position as they go to high school, and it starts talking about getting ready to go to college. And say what you want about college. People say all the time, well, college ain't for everybody. But I tell you what, If you get a college degree, your chances of having a more secure future financially is a lot higher compared to people who don't graduate from college. Even if you talk about going to trade school or getting an associate's degree, you don't think that in order to become a welder or a carpenter or specialize in HVAC or auto mechanics, you don't need the internet at home? If you think that, you are mistaken. So that's just academically, right? Well, let's talk about healthcare. Have you been to the doctor lately? When's the last time you went to the doctor's office and they were writing in a paper chart? The majority, greater than 90%, probably approaching 95% of doctors' offices now have EHR, electronic health records, so that they document about your care in the electronic health record. Well, most electronic health records are web-based, meaning that they require a connection to the internet. The way your doctor communicates with you has changed. Most doctors' offices don't place a lot of phone calls now with results. You go into the patient portal and they'll send you a message through the patient portal that comes in the form of an email or a direct message. They may even send your results through the patient portal. You can log into the patient portal and see your results. You can log into the patient portal and see your progress notes. You can see what the doctor wrote about you right there. You don't have to call the doctor to get a refill on your medication. You just go in the patient portal and request a refill right there through the phone, through an app or what have you. But what if you can't do that? What if you don't have a smartphone? What if you don't have the internet at home? What if you are technologically challenged and you don't know how to operate this stuff? That is digital divide. And not having access to the internet, to smartphones, to computers, it's more than just lacking a convenience. No, internet access and access to technology has become life and death. It really has. Did you know that those individuals who lack access to internet have about a third of the increased risk, about 25% increased risk of negative health outcomes? Did you know that? And it's not just because of the inability to pay. What if you live in a rural area where there's not a lot of broadband, where they're not laying a lot of wire for the internet? It's the same thing. There was a survey that showed that 21% of uninsured persons don't use the internet. And those who don't use the internet are likely to also lack health insurance and not be online. 59% of uninsured persons did not report seeking health information online. So do you see the adverse effect of the digital divide? 5 million households in our country, approximately, with school-aged children, do not have high-speed internet access at home. And a disproportionate share of those individuals are African American or Hispanic and Latino. Try booking a doctor's appointment without a smartphone. You can't even register for the doctor without a smartphone or a tablet. Without an email address. My God, you can't do anything in this world without an email address. It's even harder to purchase insurance, health insurance, without internet, without email, without a smartphone. We're at a disadvantage. Think about what your health literacy is if you don't have access to internet. You know how many of my patients cheat on me with Dr. Google? A lot of them. And Lord have mercy. Whoo, you tell Google your toe hurt and you come in and you swear you got cancer all over your body. Dr. Google will freak you out. But on many occasions, my patients who visit Dr. Google come in with a deeper understanding of whatever the health condition is that we're addressing or treating. They can look up, okay, for my age, what kind of health screening should I have had by now? And they come in asking about the cancer screenings, the colonoscopies, prostate cancer screening, mammogram. They ask about these things. They're able to dive deeper into their family histories, and they know if this or that runs in my family, if my mother or my aunts had this or that, then I need to be tested sooner. That's health literacy. People who have health literacy, people who have a higher level of education, more access to information, have better health outcomes. So this is why the digital divide between the haves and the have-nots is a social determinant of health. So what do we need to do? I'm glad you asked. We need to make the internet accessible and free to everyone. There are countries that you can travel to in Europe where the internet is all around. You can get on it. It's free. You don't have to pay. Now, if you want a private connection at your home that's faster and higher speed than what's available for free, have at it if you can afford it. But it needs to be available to every citizen because it is a social determinant of health, just like having access to clean water, food. Those are social determinants of health. So, the digital divide, I want you to remember that term, is a social determinant of health. And I want you to talk to your elected officials at the city level, the mayor, city council, county commissioners, governor, state representatives, your senators, your congressperson, and talk to them about providing access to high-speed internet to every citizen, because this is a social determinant of health. Well, that was episode 27 of the Prescription for Better Living podcast. I'm still Dr. Hernando Carter, board certified internal medicine physician. Yes, I'm still your primary care extraordinaire, saying, tell somebody about this podcast. scream to the top of your lungs and say, hallelujah, Dr. Carter is here. Until next time, Dr. Carter saying, peace out.